The consequences of cousin marriages are a major public health issue. It costs the NHS many millions and has huge implications for other services. A government study shows that British Pakistanis are 3 times more likely to have children with learning disabilities than the general population. And it costs nearly £250,000 a year to care for each child. So what are politicians doing? We approached 16 MPs with a significant number of British Pakistani constituents for an interview. All of them declined. We also asked 30 MPs who represent these communities to give their views in a survey. Only one, who wanted to remain anonymous, replied. He didn't answer the survey but told us it is a subject which evokes very strong emotional responses. And anybody seeking to raise a subject, even by way of giving professional medical advice, runs the risk of being attacked by individuals who have their own agenda, often political.
Why was it received so badly?
One politician who would talk to us was former MP for Keighley in West Yorkshire, Anne Cryer. She's been criticised in the past for trying to discuss the health problems caused by cousin marriages.
Do you see it then, first and foremost, as a public health issue rather than an issue about the community that one has to tiptoe around?
It's a public health issue, and we deal with public health issues by raising awareness, by talking about the subject, such as obesity, such as drug addiction, such as alcohol. But for some reason, we're told that we mustn't talk about cousin marriages because this is a sensitive issue. Now, I think that's absurd. We have to talk about this issue in order to find solutions.
And you're a lone voice, a lone public voice willing to talk about this. Why are there so few politicians prepared to come forward and say, look, we need to tackle this?
I think it's fear that they'll be accused of either racism or demonisation or whatever, and therefore they keep their head below the parapet and don't say things on this issue. It is partly about getting votes and securing those votes and not offending the leadership of these communities.
One Birmingham councillor backs the idea of open discussion. Salma Yaqub believes the key to tackling the problem lies in the way you talk about cousin marriages.
Why do you think it is that people feel so stigmatised? Why won't they talk about it? It's just far too sensitive.
Well, I think after 9/11, Muslims have felt that they've been stereotyped, demonised, or seen through this lens of terrorism, seen as a problematic community. So any discussion around Muslims is to do with some negative issue. So this issue, for example, which is a health issue, if it's framed around, well, why aren't these people stopping doing what they're doing in the face of Western scientific evidence? Of course people are going to be defensive. Whereas if it's, well, here's what the evidence is, people can now make informed choices and don't politicise it in the way that we talk about it and see it as a straightforward health issue and deal with it as such. And I feel we'll have a very different discussion around it.
Islamic experts say that Islam neither prohibits nor encourages cousin marriages. Some argue, though, that if change is to happen, community and religious leaders need to get on board. But Maulana Munawwar Hussain, a religious scholar in the West Midlands, does not accept that there is a problem.
30% of children with rare diseases are from British Pakistani families. What's your response to that kind of statistic?
I will ask, what is the percentage in other communities?
But Maulana, doctors are saying that there's a link. Families who are suffering from this, who are first cousins who are British Pakistani Muslim, are saying there's a link. The specialists in this area are saying that there's a link. Why are you not accepting that?
Well, I don't have any knowledge in that regard.
Look, I have a whole, reams and reams of evidence here, scientific evidence that proves that there's a link, and you're still denying it.
No, what I said, I don't have knowledge on that.
Well, if I gave you the evidence and you looked through it and you felt that it was convincing, what would you do about it?
I don't think I will be able to do anything on that regard. Islamically, I do not see any problem getting married to the first cousin.
Maybe not Islamically, but medically there's a problem.
Why we are talking about only the Islam, Muslims getting married to the first cousin, then if we find the same problem in other communities also, then it is equal. So it is not because of the first cousin marriage, so it is a normal case.
It is because of the first cousin marriage. It's just not necessarily because they're Pakistani or they're white or they're black or they're any other ethnic group. It's because they're first cousins, and that is a much higher occurrence of that happening within the Pakistani community because there's a tradition of marrying first cousins.
Okay, well, as I said early on, I don't have any research on that topic, so I won't be able to say anything on that.
Well, if I give you this research and you look through it...
So, well, I wouldn't mind looking through it.
And if you were convinced by it, what would you do about it?
I will decide after when I am convinced.
We sent him the medical papers and haven't heard back yet.
It's a bit hard actually to tackle the issues of these children. I don't know what is their future, how they will live even if we are not here.
In part 3, we ask if children like the Akhtars are paying the price of political correctness, because health workers and politicians are afraid of being labelled racist.
Difficult life.
With scientific research showing that first cousins who marry are doubling their chances of having children with rare diseases, why is there so little awareness of this in the wider British population? Sonia and Wayne Gibbs invited me to their family home. They've been together for 16 years. Wayne is Sonia's dad's cousin, making them first cousins once removed, something that never struck them as a problem. Their child Nicole died of juvenile osteoporosis, a genetic disease that causes the bones to thicken and crush the body's organs. They were told it was because they both carried recessive genes.
So as parents, to sort of go from having what you thought was a perfectly healthy, normal baby, how did that feel?
Upsetting. Horrible. Feel absolutely helpless. Because you know there's just not a thing you can do.
Did you decide to have a third child? Was that planned?
Well, we went through, obviously, genetic counselling, what they call it. Because obviously we wanted to know, you know, can we have any more children?
But that test for you was absolutely essential.
It was,
yeah,
yes. It was vital. There was no way we was going to even, you know, have another child if there was no test out there that could help. And also I just would have stuck at Nathan and that would have been it. So,
and now you've got two very healthy kids.
Two very healthy boys.
Do you think that people who are cousins and are thinking about getting married and at some point having children, do you think they should test themselves at that stage?
Definitely. Absolutely. It will save them so much heartache in the long run. At least then they know that they are going to have a healthy child.
For couples like Wayne and Sonia, going through genetic counselling helps establish risks and offers possible solutions. The option of a termination or IVF to implant a healthy embryo. But only 40% of genes causing recessive disorders can be tested for, meaning that genetic counselling has its limits. And yet, there is no national public health campaign about cousin marriages. The risks are not taught in schools, and there is no government leafleting campaign in hospitals or doctor surgeries as there would be about other diseases affecting children. The last big campaign on cousin marriages was 13 years ago in Birmingham, when the health risks were brought to public attention. Dr. Jackie Chambers, the Director of Health in the city, explains how some British Pakistanis opposed the initiative.
What was the reaction to your campaign at the time?
Well, I think the reaction was quite mixed. We did get some support from some religious leaders and from some communities. And for about 2 years, we were, within the context of promoting healthy mothers and healthy babies, getting some awareness of the message about the additional risks. We found out subsequently that there was also quite a hostile undercurrent. People were tearing up our leaflets, and they were also putting counter messages across in terms of what was seen as an attack on those communities.
With the campaign provoking such a negative response, it wasn't repeated. Now normal practice is to advise individual families most at risk, rather than high-profile national health programmes discouraging cousin marriage. Professor Marcus Pembry feels that targeting families individually, rather than issuing national public health initiatives, is the way forward.
You are against the idea of it being a public health issue, but many people we've spoken to, many doctors and people who work with local authorities, say that the cost of the NHS is absolutely enormous, and therefore we need to make it a public health issue so as to reduce the problem.
Of course we have to tackle it, but it's not like smoking, where people want to smoke and the public health campaign is trying to stop them smoking. These families don't want to have children with these diseases. We're all on the same side. They just need help. They're not going to change their cousin marriage straight away, because it's part and parcel of their community, and their community is very supportive of them. What they want is help with these specific genetic disorders. And with the new technology, where if there's political will, we're not wanting the politicians to say things. What we want to do is understand that we need funding for the services that will provide genetic counselling.
In Birmingham, they're introducing a new system. A confidential register of families most at risk of recessive disorders is being drawn up. They will be offered counselling and genetic testing, which is hoped will reduce the number of children born with disabilities by half over the next decade. If it works, the plan is for the government to roll this out to cities such as Bradford and London. However, British Pakistani doctors at one GP practice in Birmingham have set themselves apart from other health professionals by openly discouraging cousin marriage. Their surgery is one of the few in the country to take this radical approach. At the same time, they've introduced genetic screening and testing for common blood disorders, such as thalassemia, for all of their patients.
Really, I just wanted to speak to you again and talk to you about thalassemia and the transmission.
Today, Dr. Rizwan Al-Adina, himself a British Pakistani, is genetically counselling Kulsum Harji, who is originally from East Africa and married to her first cousin. Kulsum is a thalassemia carrier. She has one healthy baby but wants more children.
So you would either pass on the normal one or the one with thalassemia, and same with your husband as well. So in terms of combinations, this is the dangerous combination when the child has both thalassemia gene, and that child would be a thalassemia major child, but that is 1 in 4 chance. Okay. The other possibilities are the children being carriers, which is
helping patients make informed choices is a priority for Dr. Al-Adina. He says he's done this with the help of local religious leaders.
It's taken a good time, for about almost 20 years, to change attitudes, getting the support of the clergy. That is the key.